Endometriosis. Why it takes 7 years to diagnose. What if I told you that many women live with severe pelvic pain for 7 years before getting a diagnosis? Not 7 months, not 7 weeks, 7 years. And the condition, it's called endometriosis. Let's talk about why this happens and why it needs to change. Welcome to Wellness Corner, where we break down real health issues with real medical facts. Today, we're exposing why endometriosis is one of the most delayed diagnoses in women's health. What is endometriosis? Endometriosis happens when tissue similar to the lining of the uterus, called the endometrium, grows outside the uterus. Instead of being inside the womb, it can grow on ovaries, fallopian tubes, bladder, intestines. Every month, this tissue responds to hormones, bleeds, and becomes inflamed. But here's the problem: it has nowhere to go. This leads to severe menstrual pain, pain during sex, chronic pelvic pain, heavy bleeding, infertility. And yet, it still takes years to diagnose. Why does it take 7 years? 1. Pain is normalized. Many girls grow up hearing, "Period pain is normal, be strong." It's part of being a woman, so they don't seek help early. Even when they do, their pain is sometimes dismissed. 2. Symptoms mimic other conditions. Endometriosis can look like pelvic inflammatory disease, ovarian cysts, fibroids, irritable bowel syndrome. Because symptoms overlap, doctors may treat other conditions first before suspecting endometriosis. 3. It doesn't always show on ultrasound. Here's the clinical truth: standard ultrasound scans often miss mild or moderate endometriosis. The gold standard for diagnosis is a surgical procedure called laparoscopy, and surgery is not the first test most doctors jump to, so diagnosis gets delayed. 4. Hormonal treatments mask it. Many women are placed on birth control to control period pain. While this may reduce symptoms, it can also delay proper investigation. The pain improves temporarily, but the disease may still be there. Why this delay matters. 7 years of untreated inflammation can lead to severe scarring, organ adhesions, fertility challenges, emotional distress. Chronic pain also increases risk of anxiety and depression. This is not just bad periods. This is a real inflammatory disease. When should you suspect it? If you have period pain that stops you from working or going to school, pain during intercourse, painful bowel movements during your period, difficulty getting pregnant, you need proper evaluation. Ladies, pain that disables you is not normal. And if a doctor dismisses your pain, seek another opinion. Early awareness can shorten those 7 years. If you learned something today, like, share, and subscribe to Wellness Corner, because your health is not a luxury, it's your power.